Okay. So this is going to be our final exam review. And basically in this review, I just want to go over, first of all, the layout of the final exam, and also go into a little more detail with some of the chapters. I'm not going to go over each and every topic, not for this particular video, but just kind of giving you guys the highlights of, different things for each chapter. I will do another video that can go in more depth with each and every topic. That's going to take me at least 2 hours or so. So I may break that up into like a part 1, part 2. So I'll continue on with more, final exam review videos. Just to also make you aware, next week on-ground tutoring on Wednesday is the last on-ground tutoring session before we have our final exam. That one I will record with the actual video camera, and I definitely will upload that to my YouTube channel. And then and then that's it. So there'll be more videos to come, so just to make you aware. Okay, so our final exam will be 120 questions. I believe it's out of 150 points. I forgot to actually put that here. So let me just add that in. It's 150 points. So keep in mind, our final exam is actually cumulative. So it is from the beginning of the course. We do not have a final exam where it's like, okay, the second half after the midterm. This is definitely cumulative, where it just includes all chapters. So again, 120 questions at 150 points total. Multiple choice, select all of the apply. So just to make you aware, the final exam will have the same layout as our weekly quizzes, our midterm, same thing. And so just to even get into more detail with that, sometimes people want to know, well, on the final exam, are you going to have repeat questions and things of that nature? Yes, it is a possibility. Well, let me not say possibility. Yes, there will be repeat questions for sure. However, there will be also new questions, or I should say topics on questions that, questions on topics that you may have not had before in previous tests. So I would suggest to please study everything. One thing that I am behind in, and I'm so sorry, and I'm going to stay up tonight and finish it actually, is the final exam, check your understanding. For the Monday section, I actually have your final exam, check your understanding ready. I'm still working on the other sections. So your final exam, check your understanding is basically like a practice final to get ready for the actual final exam. It is a combination of all of your check your understandings that you've had over the term. So there, kind of previous questions, repeat questions. It does have a large question pool, so keep in mind you can take it multiple times. And I do suggest you taking it multiple times because it will generate different questions. Not the entire, test different questions, but at least a few questions will be different. So yeah, so that's that part. With the select all of the apply, I think we all have an idea by now of what goes on with those questions. It's either all or nothing. So it is important to make sure that you select all the answers that, correlate to what the question is asking. We do also have a section, well, I put here anatomy and physiology. So what that means is this, not that we have to go back into our anatomy and physiology textbooks all over again, but it is important to at least know some of the basic anatomy and physiology of topics that we've discussed over the term. And most of that information I did include in the PowerPoints in some of the topics. So just to kind of give you a little more detail with that, I would say make sure you cover the anatomy and physiology of blood. In particular, making sure you know blood cells, the functions of blood cells, especially in the chapter with anemias. I think we discussed as far as like the life cycle of a red blood cell and what happens there in, you know, the bone marrow and production and things like that. I think we also have some questions with the anatomy and physiology of the cardiac system, definitely in the sense of knowing the flow of blood in and out of the heart. I always have questions with that, so please make sure you know that. It's a simple memorization, but for some reason, everyone is a little shaky on it, okay? And so I just wanna make sure that we are comfortable with this before we walk into core, okay? Keep in mind the flow of blood was anatomy and physiology concept that directly correlates with heart failure, okay, congestive heart failure. And what happens is this: when your patients are having congestive heart failure and you're looking at the signs and symptoms and trying to figure out, we have to know immediately what's happening and not kind of in our head, okay, well, where does the blood come from, you know, from the pulmonary artery and so forth. So we should know this, like, you should be able to just take a piece of paper and be able to just like write it out, just from memory. So those things are very important as far as anatomy and physiology. The other concepts I would say to go over with anatomy and physiology would be just simple anatomy of like the respiratory system, and a little bit of physiology of that as well. The anatomy of the renal system, anatomy of the reproductive system. And when I say the physiology portion, just a matter of knowing the organ and the function of the organ. You could possibly have questions with that. Let's see what else. I didn't get too much into the skeletal system with that, but yeah, I think that was about it for the anatomy and physiology portion. Okay. So as far as tables, and there's a box here. So as far as the information in your textbook, there were times where I told you guys to take a look at your textbook for, info to help with, some test questions. So for chapter 7, this was a chapter that covered neoplasm. And so for this chapter, we took a look at table 7.1, 7.2. With those two tables, it's just a matter of using that information to kind of add into what you have for the PowerPoints. Table 7.1 covers the characteristics of cancer, 7.2, the nomenclature. So just kind of having an idea of the types of cancers that are there. Not that we need to memorize each and every one, but if we know the suffix oma, sarcoma, carcinoma, and we know exactly what's going on there, you should be fine. Table 16.2, and let me just go back to 7 just to clarify. From the previous videos, I know my videos are the older videos, and I've going to now start to re-record my videos by using my new YouTube platform in the future. So anyway, table 7.6 or 7.7 was a table that I spoke about in previous videos. I just want to clarify that I will not be testing you on the tumor markers, okay? It is important to know, however, what a tumor marker does, okay, or the function of a tumor marker or purpose. And I did go over that in the chapter. So we should know that tumor markers are there to help track tumor activity and things like that, and how it's secreted and, so forth. However, I will not have questions on each individual tumor marker and which cancer has which tumor marker, things like that. So I just want to clarify that you can, kind of save time and you don't have to memorize that particular table. So that's 7. I didn't write this table or type this table in here, but just to make you aware, chapter 10, I gave you guys a pretty good PowerPoint with, some additional study aids to kind of help along with that, different charts at the end. But if you do want another chart for chapter 10, I would say take a look at your textbook, and it has a table. I think it's 10.1 or 10.2. I can't remember exactly, but there's a table that covers all the different hypersensitivity types and, you know, kind of breaks down each one. So if you need an additional table for chapter 10, which I don't feel that you do need one because I think the PowerPoint has enough information. But if you feel like you need something extra, the textbook has a table as well for chapter 10. Now for chapter 16, this table 16.2, we focused on the blood pressure classification numbers. These are the only numbers that you are responsible for this term, okay, as far as memorization for test purposes. So we should memorize and go over what's considered a normal blood pressure, what's considered prehypertensive, stage 1, stage 2, okay. We had questions with that, I believe, on our weekly test, midterm, and so we'll have a question or two with that again with our final exam. Now, there was another table, or they actually title it box, and I just want to use the right terminology so you'll know where to go in the textbook. It's box 20.1. So box 20.1 covers the what is it? The different types of shock, or the categories of shock. So you were definitely tested on this information before, and you will be tested on it again. So I would go over the categories of shock, making sure we know the 4 categories and the examples under each category. Okay. And then I'll get into, you know, a little more detail with that with the chapter review later. Okay. So where to start? From the beginning. Okay, so we have all the chapters listed here, and I think I have everything listed. I don't know if I'm missing anything. I don't think so. Okay, so our final exam is going to be on chapters 1, 2, 4, 7, 10, 11, 13, 14, 15, 16, 18, 19, 20, 22, 23, 27, 28, 29, 31, 33, 36, 37, 41, 44, 51, and 52. So I know that sounds like a lot, but just keep in mind we are missing some chapters here, technically, according to our syllabus, okay? So one more thing I want to clarify. You did have a take-home assignment over the holiday break for chapters 24 and 25. Yes, for chapters 24 and 25, I believe. And that information was on fluid electrolytes, acid-base disorders. I know many of you answered, or I should say, you know, obviously did the assignment. I did hear from 2 students that the video was actually quite low, the audio, the quality of it. I did not get a chance to re-record that information. However, I did provide a PowerPoint. And so I know a lot of people were able to answer the questions based off of the PowerPoint and textbook and, you know, just kind of researching the answers. I just wanted to introduce that information to you. You'll definitely pick it up more, obviously, in nursing. But I just want to clarify that I will not put those 2 chapters on the final exam. So I did not put it here on the whiteboard that you see. So chapters 20, oh, I can't keep forgetting what it is. Yes, I think it's 24 and 25. Chapters 24 and 25 will not be on the final exam. So I just want to clarify that. Okay, so from the very beginning, and like I said, I want to not keep you here all night, okay? But I just want to go over and kind of hit the highlights of, you know, some of the chapters. So for chapter 1, in the very beginning, this chapter was, I feel, super easy concepts, just knowing, well, I shouldn't say so much concepts, but just basically knowing terminology. It was an intro to patho, so again, just going back to what we remember from before, please make sure you cover terms, the definitions of those terms, and examples. And I think by now we, excuse me, know how to include those topics or those terms within everything else with patho. Chapter 2, kind of the same thing here. We did go over some terminology. You know, here we did introduce some concepts. So in a sense, we're knowing what's happening when the body adapts to stress and knowing the organs that are affected, knowing things that are secreted. We talked about terms like homeostasis, allostasis, things like that. So this chapter didn't have a whole lot, but, you know, just kind of organizing that material, I think you'll be fine with that as well. Chapter 4 basically can be broken up into different types of cell injury in a sense where we have two major categories, reversible and irreversible. The only thing I can kind of guide you here is just making sure we know, number one, which ones fall under that category. Number two, making sure we know each topic under that category and, you know, the definition or the example of that concept. So we should know like what hydropic swelling is and everything that correlates with that. I would definitely stress cellular adaptations because that shows up all the time. Or I shouldn't say all the time, but many times in disease processes. So we should definitely know all the different types of cellular adaptation. And then I think we ended off with getting into detail with, what was it, necrosis and gangrene, okay. Chapter 7, you should know every single word in chapter 7. So, and the reason why is because chapter 7 is a chapter focused on cancers. And this chapter actually sets the stage for all the other cancers because it gives us all the concrete information that we need to know, such as what's a benign tumor, malignant tumor, and what goes along with that, how we diagnose cancer, signs and symptoms when people have bone marrow suppression, and then what happens with the blood and signs and symptoms, warning signs, you know, all of that. Grading, staging. There's so many things I can go into. So again, it's very difficult for me to pinpoint, okay, just focus on this and not that, because I can have any kind of question from chapter 7, okay. Chapter 10, I think we are super comfortable with this chapter. Hypersensitivity disorders, making sure we know the names of the different types, what's kind of the star cell or hallmark cell that's presented here, mechanism, you know, and we went into examples, okay. Chapter 11, this chapter had a lot of information. However, we did have a spreadsheet that was provided to kind of help out with, you know, organizing the material. I would say what will make life easier here is using the spreadsheet, focusing on the hallmarks of the different leukemias and lymphomas, and then knowing, like, I think it's the first the first 10 to 12 slides of that PowerPoint that kind of goes into just a lot of background as to what happens when a person has a leukemia or a lymphoma. And that's that. Like I said, with 11, focus on the first couple of slides until it gets to the actual topics. When it gets to the topics, you can still use the PowerPoint if you like, but the spreadsheet kind of shows you what are the hallmarks and just focus on that. Because for test questions, I really have to give you a hallmark to kind of help identify what cancer it is, okay? Chapter 13, and why am I drawing a blank? Okay, 14, okay. Chapter 13 focuses on anemias. I don't recall having tons and tons of questions here with this, but what we can do with anemias is definitely break it down into acquired and congenital, knowing the anemias that fall under those categories, and knowing, you know, what that particular anemia is. So just make sure you know the deficiency, because anemias are usually due to some sort of deficiency. So making sure we focus on what the deficiency is correlated with that, and you know, all any other information that was given to you. I think if you break it down into those categories, it'll help. And just keep in mind, I know how many people are on here. Okay, we have 4 people on. So just keep in mind, if you guys have any questions, you can just type in the chat box. And I'm just, you know, actually, you know, doing a quick little review here. But if you need me to go into detail with any particular topic, please keep in mind this is tutoring, and so we can definitely use that time for that. But I'm just kind of doing a quick overview. Okay, so with chapter 14, this chapter focused on blood coagulation disorders. Here we went into how people will have clotting issues, in the sense where they're hemorrhaging, the body's not clotting. So in the beginning of the chapter, we went into items like why people get screened, you know, what are some pre-existing conditions that can lead to this, and things like that. I would definitely focus on that information. Then once we got past that, we went into topics like, or the actual disorders. So like when people have, sometimes I like doing this at night because I'm stationary, but then it gets to a certain point, I'm like, oh, what's going on? I'm tired. Okay, so where was I? So yes, 14, the rest of it goes into the actual conditions and topics that, you know, happen with blood clotting disorders. And remember, as I said before, I don't really have tons of questions with this particular chapter, but we did focus on some things that are a little more common bleeding issues, like people that take aspirin, you know, or ibuprofen a lot, but more so aspirin is the issue. Excuse me, people that, you know, may have some sort of coagulation factor missing. So if they do have an actual congenital disorder, but most of the bleeding issues, as I told you before, are acquired. You know, DIC, we went into. DIC, I think, shows up in another chapter as well. So I would pay attention to that. Yeah, and that was it. Now, chapter 15 was really kind of straight to the point here with topics. So there was a few concepts in the beginning, but then we definitely went into topics like what happens, aneurysms, Berger's disease, Raynaud's, what happens when a person has varicose veins, and DVT. So those are kind of like the 5 heavy hitter topics that were introduced in 15. I would definitely focus on those topics, knowing what they are, what types of signs and symptoms people have, the mechanism, all of that was explained in the PowerPoint and in the video. The 2 concepts that we went over in the beginning of 15 was about, let me see, arterial occlusion versus venous occlusion, and what's considered a thrombus and an embolism. And so if you don't remember that, I would go over that as well. Okay. 16, pretty much like chapter 7. Know every single word with this chapter. There's nothing to really pinpoint here. Chapter 16, you need to know everything about blood pressure, how the body regulates blood pressure, hypertension. Yes, there's nothing I can say, oh, just focus on this and not that. You really need to know probably every single word that's in that chapter. Just keep in mind, just overall looking at this final exam review in the chapters, cardiac is divided into 4 chapters, respiratory 2, renal divided into 3, So you get the idea. So the point I'm trying to make here is that with cardiac being divided into 4 chapters, you can see how we'll probably have a little more questions with that. Or, you know, it's hard to tell. I'm saying that, and I should take that back because I will have a question pool, a large question pool for the final. So everyone's going to have a different final. So one person may have more cardiac questions, one person may have more, you know, it just depends on what the situation is. So I just wanted to kind of clean that up. Okay, Liliana, do you want us to know any medications for chapter 16? Yes, I would know the ones that I gave you as far as the hypertensive meds. Yes. So the, what was it, ACE inhibitors and alpha blockers, beta, you know, things of that, you know. So I think it was like 5 I gave you. Yes, I would know those. Just, and very simple, just know the name and what it's doing, the function, and you should be fine. Okay. So with 18, we kind of had a lot here as well. Okay, you're welcome. What you should know, kind of everything. With cardiac, you need to know, I mean, you need to know everything for everything. But cardiac is definitely always heavy duty. So for 18, it was broken down like this. We went into cardiovascular diseases such as atherosclerosis, coronary syndromes, what happens with MIs and things of that nature. So we should definitely know all of that information. Then 18 went into, oh, okay, I'm sorry. Then 18 also went into, what is it? Cardiac, oh, I can't think right now. Valvular disorders, and then we also went into cardiac infections, and I think that was the last 2 categories in 18. What you should know, just go over them all. Okay. 19 went into congestive heart failure, so I think we sort of have a handle on this. Okay. So with congestive heart failure, we focused on right, left, bilateral, how it's diagnosed, understanding terms like call pulmonale and things of that nature. So I think I did a good job with having the information kind of laid out in the PowerPoint and having some flow charts and things that can help. Okay. Chapter 20 focused on shock, and with shock, we went over like the different categories of shock, and what examples fall under those categories. Also in the very beginning of that chapter, it went into like the pathogenesis overall of shock. So I would pay attention to, you know, kind of buzzwords like hypoperfusion and, you know, things of that nature. The shocks that I don't know if I should say which ones I pay attention to. No, I shouldn't say that. So just make sure you cover all the different types of shock. And I don't really get into a whole lot of detailed information with it, but just making sure we know what it is, what's happening in the body, and, you know, you should be fine. Chapter, did we have respiratory before the midterm? I think so. Okay. So chapter 22 and 23, so let me just start with 22. 22 was congestive, well, I should say congestive, excuse me, chronic obstructive pulmonary disorders. Excuse me. So we focused on asthma, acute bronchitis, which is not a COPD, chronic bronchitis, and emphysema. So with these chapters, hold on, somebody wants to be part of this. For these chapters, I would say make sure you cover, oh gosh, because it went into a lot of information. I would say make sure you cover etiology, risk factors, signs and symptoms. We also in this chapter went over some diagnostic testing. You know, I would kind of look at that a little bit as well. I don't get into too many treatment questions, but the treatments I think for these topics overall are kind of the same. And I think that's it. Okay. I know 22 has a lot, and the reason why it's a lot is because it goes into a lot of detail with pathogenesis. And I think that's the issue here. If you can try to break down the pathogenesis and, you know, kind of simplify it, you know, when you make your outlines or flashcards, I think you'll be okay. Just remember with the pathogenesis to always look for like what stands out. So like the hallmark or the buzzwords, you know, with it. 23, we only had a few topics here. And so let me just go down the list of the topics. And then again, it's important for you to make sure you know everything with it. We started off with fibrotic lung disease. We had hypersensitivity pneumonitis. We also had sarcoidosis. We had occupational lung disease. And we had, I added in pneumothorax, and I think we had ARDS and IRDS. So with that information, just make sure that you, oops, I'm sorry. With that information, just make sure that you know the topic, what's happening. I put in the video the hallmarks, and you know, just if you can focus on the hallmarks, I think you'll be fine with 23. 27, oh, so let me just say, so that ends the chapters that took us to the midterm, okay? So let me just pause for a second. Does anyone have any questions with the chapters that I just went over? Okay, no, all right. Okay, so, oh my gosh, I'm sorry. It's not. Please. Computer. Okay, just disregard that writing. I have to move, sorry. Okay. Okay, excuse whatever that is off to the side. I don't know what happened. Okay, so now we're going after the midterm. So 27, 28, 29, 31, 33, 36, 37, 41, 44, 51, and 52. I don't know why I feel like something's missing, but I guess that's it. Okay. So 27, 28, 29, we know all focused on renal conditions. What to focus on here? Yeah, kind of everything. So as far as these 3 chapters are concerned, I can tell you what not to focus on, so that'll save time. I will not be giving questions on anomalies. So like when we talked about ectopic ureteral ectopy and, you know, if the kidney is missing and agenesis and things of that nature. I really don't get into questions like that because it, you know, it just, it is what it is. So it's not something that has a long drawn out pathogenesis with it. So that those topics you can, you know, push to the wayside. Now, the rest of this information, and I'm just combining all 3 chapters together. The rest of this information can be broken down into cancers, tumors, acquired disorders, congenital disorders. If you want to put infections as a separate category, you can. And this is actually the same categories you can use for 31 and 33 as well. And I believe in not tutoring, or like when I did the review for this in class that week, I broke those categories down for you, and, you know, so we were able to see what that looks like. Okay. That's the best way to organize this material. So once you break it down into the categories, then you can put the conditions under those categories. What you should know about the condition is this. Make sure you cover the etiology or risk factor for it. Make sure we know what it is, which is part of the pathogenesis, and signs and symptoms. Okay, and I think that that's kind of like, obviously you guys know that's kind of like my focus. Treatment questions, maybe here or there. Now, if I do give a treatment question, keep in mind my treatment questions are pretty simple and straightforward. So if the patient's lacking something, then, you know, the treatment will be that, or, you know, something like that. So it'll be really easy enough if you have a treatment question. So I would say this is the best way to tackle 27, 28, 29, 31, and 33. Okay. There's a lot of information in there. So I'm not going to go into each and every topic, but I would say that's the best way to organize it. Okay. If you have any particular questions with any topics in those chapters, like I said, feel free to type it in the chat box and I can address it. Okay. Now, 36, 37 were more like, well, let me just start with 36 first. 36 focused on GI disorders, okay? Everything GI related. And there was a lot. I think it was, what, 99 slides or something like that. So just to kind of help you along here, the first maybe 20 slides, I can't remember exactly. The first, I don't know exactly what, but anyway, the slides before the actual conditions start, I don't know exactly how many slides, but those slides went into like the signs and symptoms, breaking down what's happening, you know, why they have diarrhea and all that. I would go over those topics and make sure you know what they are. It really shouldn't take you that long to kind of memorize that. So if you can just know what's happening there, and then when you get into the actual conditions, that is where you want to spend most of your time memorizing information, because I'll definitely have more questions with, you know, all the topics. Okay. So with all the GI disorders, we can definitely break this down into acquired, congenital, and if you want to maybe have a section for infections, okay, just to make it a little easier to manage. Again, pay attention to risk factors, etiology, pathogenesis, signs and symptoms, okay. Same kind of deal here with 37. Chapter 37 focused on acute, well, I shouldn't say just acute. It focused on gallbladder and pancreatic disorders. We did get into the acute and chronic types of those. And then we also went into like the infection, you know, portion of it. Again, Etiology, risk factors, very important. Pathogenesis, very important. And signs and symptoms. Okay. 41, and this is where I made a mistake with 41 because I wanted to give you guys more information with it. However, we should be fine. With 41, we just went into very simple information with diabetes mellitus and focusing on type 1, type 2, and gestational. Knowing what they are, and you should be fine. And knowing not only just what they are, but making sure you know the difference between non-ketotic hyperosmolarity versus ketoacidosis, knowing which one has the polys, and some of the things that we know that are hallmarks that we went over in that particular chapter. Now 44, 51, and 52, we actually just had a quiz on this information this past week, and so I think this should be fresh in everyone's head. 44, we know, covered acute brain disorders. So we went into stroke, cerebral aneurysm, and brain infections like meningitis and some others. 51 went into pretty much all the different types of skeletal disorders, musculoskeletal disorders, from fractures to bone conditions that can develop, maybe acquired or congenital. And what else did we go into? Cancers. So everything here, or what I told you guys to memorize for this week's quiz, is the same thing, okay, for the final. And the same thing also for 52. 52, we put a lot of focus on osteoarthritis, rheumatoid arthritis, and gout. I would say we're kind of like the heavy hitter topics with 52. However, we did cover some of the other conditions that are primary conditions that have secondary arthritic changes. So I would just know those topics, okay, so we'll know, how they're correlated, okay? And I know that was like really quick. I don't know if it was as detailed as you guys wanted, but I just wanted to give you a quick overview so you can just have a little direction here to, study for the final. As I said before, I will do a more in-depth final exam review, probably via as a video like this, or I am starting a new platform with the YouTube. Okay, so I did set up my YouTube channel. So for individuals that were not able to come to this tutoring session, this video will actually be uploaded onto my YouTube channel, and I will be sharing that link with everyone, okay? So does anyone have any questions at this time? Okay, so remember, even though I'm going over like a little overview, but this is still considered your tutoring session. So if you have any particular questions, this is a time that I can address it and go into more detail. Okay, so Liliana, no, everything is good? Okay. All right, you're welcome. So if you guys do not have any questions, I will call it a night. Like I said, I will be doing another video that will be a little more in depth. Not sure exactly if I'm going to do it, what's today? Today's Friday. I may do it Sunday, okay? So just so I can get the hang of this new YouTube channel, I'll do that on Sunday, possibly, but I'll definitely share it with you guys and let you know. It may be kind of last moment when I figure it out. Sheila has a question. So is the check your understanding assignment for the final grade? Yes, it is. That one does have points attached to it. So I want to say, yeah, I know it's weird. It's only 5 points. Okay. I didn't make that up. Someone else did. So yes, it's only 5 points. Yes, it does have points attached to it. As I said before, the Monday section, if you're in the Monday morning section, I know there's 2 sections on Monday. The Monday morning section, 8 a.m., the check your understanding for the final is ready. It is now ready for you to go. The other sections, I'm still working on them, and I'm going to finish them up tonight. And I will post an announcement, you know, late tonight to let you know that they're ready. And remember, your final exam check your understandings are not due until the day of your final. Okay. And our final exams are scheduled for Wednesday, January 23rd, no, 22nd. Wait, I'm trying to find my calendar. January 22nd. Okay. So January 22nd. And I will also post that information again as well, just so people will remember. Okay. Okay. So are there any other questions? Okay, so I'm gonna call it a night, and I hope this was beneficial for you guys. And again, if you have any questions, feel free to email me, but I will be posting some more information, okay? Take care, good night.